Okay. You want to compare the heart rate and the radial pulse to ensure that both that there is no pulse deficit. You want to listen to the breath sounds in all five lobes and listen for the anterior, the posterior, and the lateral. You want to note if the sounds are not equal. You want to inquire the patient to cough or the spectrum production or shortness of breath or any extrusion. You want to inspect the abdominal shape and size. You want to listen for presence of activity, level of bowel movement or pain. You want to make, in all four quadrants, you want to make sure that there's no hyperactive bowel sounds or hypoactive bowel sounds. You want to palpate the abdomen firmness and masses, noting if the pain is elicited or if there is no pain. You want to inquire regarding nausea, vomiting, indigestion, or discomfort. You want to inspect any tubing equipment or dressings of the chest and abdomen to make sure they're working properly and functioning. After you finish the abdomen and the chest cavity, you want to go to the upper and lower extremities. You want to make sure that you palpate the radial pulse for strength and quality of both sides. You want to palpate the hands for edema and warmth. You want to check the nail beds for color of capillary refill. You want to assess the range of motion in the arms and hands. You want to assess and grip for bilateral equal of strength. You want to inspect any tubes or equipment, dressings that might be on the arms or lower extremities, and you want to make sure that they are working properly and functioning. You want to inspect the lower legs and the feet for any color, edema. You want to palpate the feet, ankles for edema and skin temperature. You want to assess the capillary refill time. You want to assess the range of motion and inspect the tubes or equipment. You want to inspect any tubes or equipment or dressings in that area of the lower and upper extremities to make sure that they are working properly in functioning properly. You want to follow the ending steps with your documentation. You want to allow the patient to ask any questions. You allow the patients you document the assess and findings in the patient's chart. You evaluate whether there are any findings of changing in improvement or worsening in the patient's condition. You want to document the assessment and check it from the previous assessment to make sure that the patient condition is the same or it has improved or it has deteriorated. And after you do all of those steps from head to toe assessment, you want to document your credentials, the date, and the time of when you did your head to toe assessment. Thank you.